This time on Poll Hub, if it's not one healthcare crisis in America, it's another. Healthcare debt is the latest major problem to plague our healthcare system, and we're taking a deeper look at that. Then, American funk. No, not George Clinton or Prince. Funk as in we are in a funk. Multiple poll indicators say as much, but as always, we aren't all in that funk for the same reasons. We'll explain. Then it's summer vacation season, if you can afford it. Our fun fact this week heads back to the 1950s to see how much a dollar bought then, and you might be surprised. So let's get to it. And hi, everybody. Welcome to Poll Hub. I'm JD Dapper.
And I'm Mary Griffith. Well, Jay, our listeners are stuck with us today. Liam Barb will be back with us next week. And unfortunately, there's something else that many Americans are stuck dealing with, and that's mounting medical debt. In fact, 100 million people living in the United States are facing this difficult issue, and that's according to a new poll from the Kaiser Family Foundation and NPR. So today we're joined by Noam Levey. He's the Senior Correspondent for Kaiser Health News, and he's here to put this issue into context for us. Welcome.
Hi, nice to be with you.
Well, that number, 100 million people, it's certainly jarring. How widespread is the problem, and how have we gotten to this point?
Well, I think it's important to understand that this is much bigger than I think most people realize. In our poll that we did with the polling and survey team at KFF found that 41% of adults, which works out to about 100 million people, currently have medical debt. And if you ask people about their experience over the last 5 years, it's 57% have had debt from medical or dental bills in the last 5 years. So, I mean, the problem is immense. And I think one of the reasons why it is so much bigger, I think, than people may realize is that there are a whole host of ways that people borrow and go into debt as a result of a medical or dental bill. The traditional way of sort of thinking about this has been looking at credit reports and looking for past due medical bills that end up on people's credit reports. And that's a big problem as it is. The past due medical bills are the largest line item on people's credit reports nationally, according to the CFPB. But that doesn't capture the payment plans that people go on when they go to the hospital or the dentist or the doctor's office. They can't pay the $2,000 and the hospital says, well, pay us over 36 months, in monthly installments. Sometimes it could be longer. It doesn't capture credit card use. An enormous number of Americans use credit cards to pay their medical bills, and then they don't pay the credit card off after the end of the month. So this becomes credit card debt, but it's really medical debt. And then one of the really, I think, frightening and disturbing parts of the borrowing that people do is from friends and family. We found that 1 in 10 adults had borrowed from a friend or family to pay a medical debt. And that it's hard to really quantify what the impact of that is, but that obviously can create, difficult family dynamics and really upend people's lives, which is, I think, broadly speaking, what we found in this project.
One thing that I think stands out to me about this is we've had a healthcare crisis of one kind or another for pretty much almost as long as I've been alive. We've gone through it in one administration after the next presidential races have been won and lost on tackling the healthcare crisis in America. Generally, it was about insurance and uninsured individuals. And I think after Obamacare, and some of the fights about Obamacare, trying to kill Obamacare, but all that seems to be past. And yet, having all of that had happen, we're now in a position where there's a new healthcare crisis, or maybe not a new one, but one that seems just as serious. Why didn't those things like Obamacare, why didn't those solve or help solve this problem?
So you're right, Jay. I mean, the conversation really around health reform in this country has been about health insurance coverage. And I think there was a presumption that expanding coverage, giving somebody a health plan, would solve the problem, because medical debt and unaffordable medical bills have been with us, as you indicated, from time immemorial, it seems like. And I think it's important to note that the Affordable Care Act, Obamacare, did do some really important work in this regard. Lack of health insurance is a greater predictor of medical debt than if you have health insurance. And so the fact that the law expanded coverage to millions of people who previously didn't have it has protected many people from having even more debt. But one thing that the law couldn't do was slow this transformation in health insurance that's happened in this country over the last 15 to 20 years, as employer-based coverage, the kind of coverage we all get through work, has increasingly shifted to these high deductibles. And all of us, and many of us, are now in health insurance plans that require $1,000, $2,000, even $5,000 or $10,000 that the patient has to pay before the insurance really kicks in. And one of the things that we asked in our poll was how many people could pay an unexpected $500 medical bill out of their savings, out of their
$500, just
$500, not
yeah.
$5,000, $500. And basically half of American adults said they wouldn't be able to pay that. So many people are living paycheck to paycheck in this country. It doesn't take, a PhD in economics to realize that if you only have $500 in savings and you get a $5,000 bill, there's going to be a problem.
Does this problem pertain to certain demographics, or is this really demographically neutral?
No, it most certainly is not demographically neutral. Medical debt is much worse in Black and Latino communities. The poll found that Black adults are 50% more likely than white adults to have medical debt. Medical debt is, as I mentioned earlier, worse if you don't have health insurance. It's worse for lower income Americans. It's worse in certain parts of the country. And perhaps most disturbing, it's worse among people who are sick. So we looked at kind of where medical debt is concentrated in communities around this country. And if you look at the medical debt load at the county level and you look at where people are sick, counties in this country that have high levels of chronic illness, cancer, diabetes, heart disease, those are also the communities that have the highest level of medical debt.
What kind of solutions present themselves here? Because again, we talked about insurance coverage being a predictor. If you don't have insurance coverage, you're more likely to have a lot of medical debt. So yeah, get everybody insurance. That would solve some of the problem, but it doesn't sound like that solves all of the problem. What kind of solutions are being floated out there that might help or might correct this?
So some of the solutions that have been talked about so far have focused really on protecting people's credit, stopping the worst excesses of debt collection companies. So the credit rating agencies earlier this year said that they would remove some medical debt from people's credit reports, those that were smaller, those that had been paid off. The Biden administration has indicated it wants to crack down further on, debt collectors and how they call and how they file suit against people. But I have to be honest with you, I think this is really around the margins. As long as we have health insurance plans that require thousands of dollars in out-of-pocket spending and networks that kind of flummox patients so they end up in the hospital and the doctor is maybe out of network and what have you, that we're going to have these very, very large medical bills that people are going to be subjected to anytime they have a major medical event or, God forbid, a sort of long life-threatening illness like cancer. So other major industrialized countries around the world have, whether they have government-run programs or whether they have private health insurance, they all essentially cap how much patients can be required to pay out of pocket. And Obamacare, the Affordable Care Act, did put some limits, but they've proven too high. And I think until we have health insurance that requires the level of cost sharing we have in this country, we're going to have medical debt.
Well, Noam Levey with Kaiser Health News, we certainly appreciate your perspective today.
Thanks so much for having me.
Thank you.
Oh, if that's not a reason enough to get you a little down, here's a segment that's unlikely to lift
Jay,
your
there's
spirits.
more?
Yeah, there's more. We titled this segment American Funk, and if it was only about Prince, that would be great. It is not. We are in a funk. Really, one of the first times since the famous late 70s when Jimmy Carter was president, he talked about a national malaise. And a lot of people think that and a couple other things were the reason that he lost to Ronald Reagan in 1980. But there is no question from the public opinion polling data we're looking at that we are at kind of a historic period of Americans not being terribly happy. A couple numbers, and then I'll let Mary explain why we're in a funk or not. 38% of Americans are extremely proud to be Americans, and 27% are very proud. So that combination is 65%. Sounds good, right? That's the lowest that it's been since Gallup has been tracking this all the way back to 2001. Extremely proud is at new lows for Republicans, 58%, independents, 34%, and Democrats down to 26%. Before 2015, it was never lower than 55% of US adults saying they were extremely proud. The other number here is right direction, wrong direction. It's a question we ask at the Marist poll all the time. Other people ask it. It's asked all the time by pollsters. Classic question. We are at 85% of Americans saying the country is headed in the wrong direction. The one interesting note I want to point out of this is an AP NORC poll. They've been tracking this. Obviously, they ask every month. The number of Democrats in January 2021 who said the country was going in the wrong direction was 22%. It is 78% now. Republicans, it hasn't changed that much, 79% to 92%. But Democrats have driven this number. Everybody thinks the country's going in the wrong direction. But Mary, not everybody thinks that for the same reason. That's kind of the underlying theme here, right?
Yeah, so when we look at some more Gallup numbers, more than 8 in 10 Americans, 85%, think that economic conditions are getting worse. So there's the economic component here. President Biden's job performance rating, that's also an issue. 57%, according to Gallup, disapprove of the job he's doing. And 82% are not pleased with the way Congress is doing its job. So there's a lot of discontent among Americans, as you pointed out, Jay, for different reasons. But in a nation as polarized as ours, is this really surprising? I mean, our politics have become part of who we are, more so than ever. And so, you've got Democrats on one side of the aisle not happy with certain issues, and Republicans on the other side of the aisle not too happy either. So is this surprising, Jay?
Yeah, I mean, I don't think it's surprising. I do think what's interesting is that I think we really, as with everything else, come at it from different angles. So there was an interesting question that Gallup asked, the way they asked the question in this most recent poll here, and it was in early June, where they asked open-ended questions. Now, most of the time in polling, we don't ask open-ended questions. We give a choice of options. And unsure is one, or I'm not going to answer is one of the options. But open-ended says, answer how you want. And so one of the open-ended questions was, what is, in your own words, the most important problem facing the country? A classic question. It's been asked for, decades. And it's great as an open-ended question because it lets people kind of say what they want. And if you look at the numbers, there's lots of very small percentages because there are a lot of answers. But if you group them, the biggest number by far is something to do with the economy. But government, poor leadership, was it 18%? Guns and gun control, was it 8%? Crime and violence, was it 6%? It suggests that some people, for the economy, that seems to be the underlying theme where a lot of people are upset. But you can read between the lines that there are a fair number of Democrats who think the country's going in the wrong direction because of what happened, for instance, on January 6th. And there's a fair number of Republicans who think we're going in the wrong direction because of things like immigration. So it doesn't mean that we all agree that the country's going in the wrong direction, that we all think that it's going in the wrong direction for the same reason. And I think that's what's interesting when you're looking at these broad questions, is that they don't necessarily tell you what you think they do on first glance.
Absolutely. I just wonder how much this has to do with stale perspectives in politics as well. When we think about our leaders, when we think about our candidates, do Americans want something new? Do they want politicians and leaders who have not been, in office for decades in some cases?
Can't imagine who you're talking about, right?
No, I'm not naming any names.
The leadership in both parties, in the Senate and the House, and the last president for the Republican and the current president for Democrats are all, everybody's in their 70s and 80s. It's crazy.
And I want to sort of hone in on a recent New York Times Siena poll that 26% of Democrats want Joe Biden to be the party's nominee in 2024. But when you look at some additional numbers from that same poll, Biden is still competitive if Donald Trump were to run again, but you have to really dig into the independent numbers to sort of see where things are going. I believe, don't quote me on this, but more than 1 in 10 independents wouldn't vote for either or would want a different candidate altogether. So, maybe this is part of the funk that we're in, that we're not looking at new ideas and new candidates in our American political system.
Yeah, it does kind of feel like, and look, none of us have been around forever. So there's lots of periods in American history when you read the history books, you go, oh, wow, really? The 1830s were that crazy? Or the country came this close to falling apart in 1800, right? It had only been around for a few years. So it's easy to kind of look just in our own perspective at just in what we have lived through. But this does seem to be something of an inflection point. And I think part of it is, Mary, you're right. It's that there's a generation of leaders who are, that is the end of that generation. We're about to see, Gen Z and millennials elected to office, biggest generation, in our modern history. And that's going to change everything. So I think this is an inflection point, and it kind of doesn't surprise me that we're in a funk at an inflection point because everything is so uncomfortable for everybody. Partly because of the generational thing, partly because of the economy, partly because of what's happening in our partisanship, being everybody's angry all the time. I just think there's a whole lot of reasons for people to be unhappy. One other thing that I saw recently that strikes me as underlying this is the amount of people paying attention to news
Yeah.
has dropped precipitously. Ratings are down, interactions on social media down. People are just like, I don't want to know. I just don't want to know. I think that says something too.
Well, now that we've gotten funkified, for better or worse, we don't have Lee here this week, Jay, to talk about the fun facts. So why don't you take it away?
Oh, okay. Well, so this would be a good one for Lee because it's based on a poll that was taken in 1954. And Lee likes to remind us that he doesn't remember 1954. And we'll just leave it at that. So we were looking at summer vacation costs in the 1950s, and that's very applicable right now because if anybody's even taken a weekend jaunt with inflation the way it is, especially gas prices and everything else, it's crazy. I was just looking at hotel prices in cities that nobody wants to visit. I mean, they're just not. I'm not going to throw anybody under the bus here, but it's not a city that anybody would care to go to. And like a bad hotel is $300 a night in this city that nobody wants to go to. I don't get it. Anyway, so how much money do you plan to spend, or did you spend, on vacation this summer? This was asked in July in 1954 by the Gallup Poll. They've been around a long time. 31% said $100 or less. 31% said between $101 and $200. 15% said between $201 and $300, and 13% said more than $300. So before we comment on that, though, Mary, what was $100 worth in 1950?
Well, I would take a guess, but I'd be wrong. So thankfully, our crack research team, $100 in 1950 is equivalent to around $1,200 today in 2022. So
that's $1,200. 31% spent $1,200. 31% said spent between $1,201, say, and $2,400. Is it really that different?
Oh my gosh. We're looking at, do you plan to spend on your vacation this summer? I'm going to say yes. It is really that different because that's total. So, I'm not going to, like you, Jay, not going to throw anyone under the bus, but my family and I went away for 2 nights to a nearby themed resort, shall we say. And the room rate alone, and then admission to certain, activities, it's exorbitant. It's absolutely exorbitant. And that's before they give you the wristbands that you don't even need your credit card or cash to pay for souvenirs and stuff that you just sort of wave over the scanner and your room gets billed. So
yeah, those are dangerous, right?
Oh gosh, I would love to go back to, what was it, 1954?
1954, yeah. But now keep in mind, the big changes from 1954 is in 1954, I'm guessing the vast majority of these people took car trips because planes were very, very expensive. And there was no, Disneyland or Disney World or anything like that. There were, to go on vacation to and to spend your thousands of dollars on wristbands or whatever it was. So maybe the lesson here, Mary, is that we can go back to 1954 and prices adjusted for inflation if we just vacation like people did in 1954. Pile up the car, go up to a national park, set up some tents, have a cookout.
What's the price for my mental health with my children in tents for a couple days?
I'm not touching that one.
That's it for Poll Hub this week.
Poll Hub is a production of the Marist Poll at Marist College in Poughkeepsie, New York.
Mary Griffith is our executive producer.
Casey Schaff is our production supervisor.
The Poll Hub team includes Greta Stuckey, Mike Bowler, and Will Promisel.
If you enjoy Poll Hub, please consider leaving us a review. Positive reviews help other listeners like you find us.
If you'd like to learn more about polling and survey science, check out the Marist Poll Academy, our free online learning portal.
If you have questions for us, tweet them at us at Marist Poll.
Remember, you can always tell your smart speaker to play Poll Hub.
And, with any luck, it will cooperate.
Finally, wherever you listen to Poll Hub, there is a subscribe button.
Click it and the latest episode will be ready for you in your podcasting app as soon as it's released.
We'll see you next time.